Good afternoon, everyone. We're just going to wait for a few more seconds to allow other participants to join before we kick off. So good morning, good afternoon, and good evening. Thank you so much for joining us. This is the third and final of a series of events that have been organized this week by UHC 2030 and the Digital Connected Care Coalition during Digital Health Week. So we're really excited that you've joined us today. I'm Claire Morris. I'm the Director of Social Impact at Babylon Health, which is a global digital health company based in London, which is where I'm speaking to you from today. And I'm joined by fellow panelists, Neeraj Jain, who is country leader for PATH India, and Dr. Ademola Serrano, who is with Farm Access Foundation in Nigeria. So I'm really excited to be on a panel with both of them. As those of you who have been participating in Digital Health Week throughout this week, you'll all be aware of obviously the great potential that we believe digital health has to really help increase access, equity, inequality to quality healthcare and to advance UHC by 2030. But in order to really maximize this potential, we believe that there has to be collaboration across actors and stakeholders. Public sector, private sector, NGOs need to work together. And how do we really foster and facilitate this collaboration? That's kind of been the theme of the series of events that we've been participating in this week. So today's session is really a deep dive into specific projects that really bring this collaboration to light. And these projects are all connected to the Digital Connected Care Coalition. So before Neeraj and Serrano talk about the great case studies that they're going to share with us, we'd like to talk to you a little bit about the Digital Connected Care Coalition, which is an action-oriented platform to accelerate UHC by 2030. So I'm just going to talk a little bit about it. And as I do talk, a couple of sort of housekeeping points. One is that this session is going to be recorded and will be shared afterwards so that you can share it with other colleagues. Secondly, as we talk a little bit about the Digital Care Coalition, do consider joining us as a member. And when Serrano and Neeraj speak, they'll be sharing their presentations, and we'd really encourage you to put in your comments, ask questions. We're going to have a session of sharing, having a bit of a discussion afterwards, but we'd also really like comments and questions from the audience as well. So thanks for that. So the Digital Connected Care Coalition, just a quick introduction but before we kick off, and if we can go to the next slide, please. So as all of us who work in the health sector know, and particularly those in digital health, know that there is a huge challenge still ahead of us in terms of the percentages of the world's population that don't have access to essential healthcare, and the number of people that are pushed into poverty each year because of out-of-pocket expense. So we know that something needs to be done. We know that this problem not only is not going away, but is in fact becoming larger. And despite the commitments that have been made in terms of sustainable development goals, there is really more that needs to be done. we believe, and if we can go to the next slide, we believe that digital health has a huge contribution that it could make to this challenge, and that digital healthcare tools and services can really make a huge step towards the consistency of healthcare service and access to healthcare in emerging markets. And these are sort of three areas in particular that we're drawing out here, but there are many others. One is digital health records, looking at obviously greater consistency and access to information for decision making, both for clinicians, for the health system, but also eventually giving greater control to the patients themselves. Telehealth, which is enabling people to access healthcare services wherever they are, reducing the opportunity cost of seeking care, reducing the inconvenience of seeking care, and also really importantly, optimizing the scarce health personnel that we have for delivering health services, and artificial intelligence that has huge potential to really transform what professionals can do, how things can be diagnosed, but also there's huge advances in the areas of self-care, and again, putting greater control in the hands of patients. So these are just some of the areas that we want to highlight. However, there is still a long way to go. And while a lot of countries do have digital health strategies, there are still challenges in really implementing that, taking things to scale, and really realizing these benefits. And these are a few of the areas which I know have been discussed during Digital Health Week, that are some that we feel that need to be addressed. We're talking around obviously the lack of scalability and replicability, the fragmentation of information, that initiatives are siloed, that we still have a long way to go in terms of developing the capacity of the digital health workforce, both in terms of the professionals, the clinicians, service providers, as well as individuals at government level, in order to be able to kind of assess and decide what are the best digital health initiatives, through to regulation that still has a way to go in terms of how it's developed, and funding, which is fragmented, and we haven't got yet enough sort of sustainable business models. So in comes the DCCC, where we are, which is a multi-stakeholder coalition, which has a shared commitment to trying to accelerate universal health coverage by really using digital health to transform that in low and middle income countries specifically. So we have a commitment that and coming back to what we were talking about at the very beginning around collaboration, that we really want to see collaboration between sectors, and we want to foster in particular the role of the private sector. So this coalition is really focused in on trying to facilitate private-public partnerships, really helping to shape the digital health infrastructure that's going to be necessary to make initiatives successful, and to really look at how we can co-create integrated solutions across the healthcare continuum. And just in terms of the background, this initiative, this coalition, was in fact set up by Philips and Farm Access, who are celebrating 20 years this week. So happy birthday to Farm Access, with the aim of contributing to the Sustainable Development Goal 3. We have members from across sectors, from those like my own organization, which is a private sector digital health company, through to NGOs, social entrepreneurs, funders. So it's a really unique collaboration and coalition between different sectors. We try and really activate member involvement, which you'll be hearing a lot more about today, as well as really fostering active collaboration. And at the bottom, you can see the companies and organizations that are involved in the DCCC at the moment. And we work in a range of ways, but it's really about getting the right stakeholders together, fast-tracking projects, which we're going to hear about two of them today, and really facilitating active learning that is based on actions, learnings, and practical sort of implementation. So we really encourage you to get in touch with us and to find out more about us, and obviously to contact both Jeroen and Madelon if you want to know more, but hopefully we'll get some more questions and discussions after this. So I'm really now very excited to hand over to Dr. Ademola Serrano from Farm Access Foundation, who will kick off with the first case study from his initiative in Nigeria and Tanzania.
Thank you very much, Claire. And let me say welcome to everyone once again to this small presentation on Take Care Africa. Next slide, please. So Take Care Africa is a Pan-African online health information platform. We're meant to provide accurate, reliable, relatable, and actionable healthcare information to meet the population of Africa. The way we're trying to build, the way we've been building it so far, it allows for replication, it allows for scale across the different countries in Africa. We're starting in Nigeria. In Nigeria, it's called Kulawa, which means take care. In Hausa, in Tanzania, it's called Swahili. It's called, Jijali, which is take care also in Swahili. The need for, I have to say, health information is really critical and is really key across Africa right now. We have a lot of, in terms of health tech, we have a lot of innovations that are going on. Something like sensor technology, for example, helping navigate, let's say measuring your blood sugar, for example, through your watches, but when you bring it down to developing countries, you bring it down to what's happening in Africa, in sub-Saharan Africa, you'll find out that most of the time, what people really need is just simple health information. And that's what Take Care Africa is trying to do. It's trying to give or help the population of Africa navigate the health system and navigate the health market across the various countries. Right now, we have developed what we call the proof of concept, different platforms, like I said, in Nigeria and in Tanzania that we're starting in. We have tested this proof of concept across Nigeria. We're testing it in Tanzania very soon. As you can see there, the platform providing health information is supposed to be easy to navigate. We tested that, and yes, over 90% of the people confirmed that with us. Easy to use, as well as locally relevant. Like I mentioned before, one of the key goals is to make sure that the platform has contextual, locally relevant and relatable health information for the people who are coming on board or who are going to be using it. So far, we have been partnering with the National Medical Association in Nigeria and the Medical Association of Tanzania. And this is to provide, again, locally relevant and key content. When we started the development of Take Care Africa, we first did some local research. Some research with people who are going to be potential users of the platform. We did qualitative, we did ethnographic studies, and we asked them how exactly do they get their online information? Where exactly do they get their health information from? The first thing that we found out was that one, most of the health information came from their health workers, from their personal health workers, people who they trusted, people who they went to for anytime they had a health problem. That was the first thing. Second thing was that most of the next phase of their health information came from international experts, right? And that led to how we partnered or how we want to partner with various organizations. For example, the National Medical Association is an association of doctors who patients see, who patients go to both in the public and private sector. We knew that this was going to be a key partner for us to bring on board because people trusted the health information that, that came from the medical doctors. Same thing with experts that we have on board, like Rutgers International, who is providing sexual and reproductive health content for us. And we knew that, yes, if we wanted to get people on board faster and people make sure that people trust the platform, then we have to have key international experts like Rutgers International. We also want to, also talking to different other types of partners. For example, for market entry, we want to make sure that we have some telcos on board. In Nigeria, we're discussing with MTN and Airtel. In Tanzania, we've also started talks with Zantel and Vodacom. And we also do need financial partners, which is one of the reasons why we are here. The way we see the platform develop, or the way we feel the platform become sustainable, is to have different types of financial partners. Some doing advertising, some doing promotions, then others who are key investors and donors to the platform. So with advertising, we see people who just come advertise their health services, their health products and health goods. We want to partner with organizations who will come promote various health outreaches, maybe in terms of hand washing, in terms of vaccinations, for example. For investors and donors, yes, we also want to see that partnership from them. So far, we have had, we've been developing this platform with a grant from Acmea Foundation, and they've been so good to do that for us. So I wanted to go back to the need again for the platform. Now, because I know some people say, this is a digital platform, this is an online platform. How many people, what's the addressable market? How many people can access your services once you're putting health information online? And in truth, comparatively, when you compare it to Europe, when you compare it to other Western countries, it seems as if the digital penetration or the penetration of the internet is pretty low. However, it is growing really fast. Right now, in total in Africa, we have about 66% of the population. That's about 700 million people who have smartphones already in use in Africa. In Nigeria, as well as in Tanzania, we have roughly about 50% who access the internet on a daily, right? Most of this are young people who prioritize information about, for example, sexual and reproductive health, who prioritize information. They want to get information on the go. They want to get it quickly, and they don't have time to go through the regular, not untransparent information channels that existed so far, right? So again, this is one of the reasons why the platform is necessary at this stage. Next slide, please. And we're using this, of course, in our business model. This flywheel shows our business model across the two countries we're working in now and how we're going to scale it to other countries in Africa. The most important part of this, or the first part of this rather, is great content, right? Which is one of the key reasons why we're following our research to show that or to get on board personal doctors who provide that relatable content. And of course, to get aboard international experts who provide the global expertise in different content areas. So with great content comes more visitors. We're going to attract more visitors once we have that content all well and good. And more visitors, of course, will bring in greater page views, we bring in repeat visits, which are very important to financial partners who want to advertise, financial partners who want to do health promotions. And with that, we're also going to get in more investments, which will enable us to provide even better content. So the simple flywheel, we're proving the model right now in Nigeria, moving on to Tanzania first quarter next year. And this flywheel is going to help us replicate it across Africa. We're planning to move, next slide. We're planning to move into Kenya, we're planning to move into Ghana before we move into other countries in Africa. Here you can see the total addressable market in the various countries and what we want to get from that. Now this market again shows those who have, or these numbers show those who have smartphones, shows the smartphone penetration. And you see how it is growing across the 4 years. And what we see as the number of site visits on visitors across these various next 5 years as we're going along. So finally, we're going to be doing, about 80 million visits in these more or less 6 countries that we would be in by 2026. We have planned out a very steady growth rate in Nigeria, Tanzania, then Kenya, then Ghana. than in other countries like in Namibia. Next slide. So again, one of the reasons why we're on this platform, one of the reasons why we're discussing this is because, again, we want to meet with a lot of partners. We want to meet with, engage with a lot of organizations as we go along. We heard our content strategy is to be locally relevant, one, and also to have that global view of international expertise. So we are looking for content partners who provide this for us. We're currently working with the different medical associations in each of these countries. That's very important. And we're also working with Rutgers International for SRH content. We're looking for more organizations to partner with for content. I also mentioned health promotion and advertising. Advertising, yes, health goods, health services, and co-creating promotional campaigns. We're looking at various things that are here: hygiene, infection prevention, vaccination, especially as it relates to the pandemic nowadays, and contraceptive use. We want to expand. I've been talking about scaling the platform to other countries, Francophone countries. They may seem the same, but anybody who's been to different places in Africa, we all know that it's not, Africa is not a monolith. We have different key characteristics in each of these countries that ensure that we would need someone to help us navigate those countries. And we are looking for those kind of partners. We're also looking for, as I mentioned before, those who are ready to invest. Acmea has done a great job so far. We're looking for more people who are ready to invest social impact, as you can see there, and make it more self-sustainable in that sense.
Great, Sarana, thank you so much. And I think we'll probably have a little bit more time to discuss some of those asks and see if we can find some potential collaborators for you among our audience. So I'm going to hand over to Niraj, who's going to talk about the Lighthouse initiative that PATH are leading in India.
Thank you. Thanks, Claire. And good morning, good afternoon, and a very good evening from India, from New Delhi. Thank you for joining us. I come from India, where it's a large country with a lot of people, 1.4 billion almost. And it's a Herculean task to actually manage primary healthcare, which is going to be the way to universal health coverage. Liam, if you can just go to the next slide, please. So we're going to talk about primary healthcare in India and the strategy around that. The next slide, please. So the challenge in India is that primary healthcare in the government facilities is fairly inadequate, while there is a call to actually fix that, to really uplift that. But I think from where we're sitting, while the government is doing its bit, but there needs to be a coalition of partners coming together to really build models on how primary healthcare can make that huge leapfrog from where we are to where we want to go. Being a large country, having a lot of facilities, we don't have enough people to actually man them or train people. So technology and digital technology more so is going to play an extremely important part in that space. India has decided that 150,000 sub-health centers across the country are going to be converted into health and wellness centers. 75,000 of those are already on the way, although again, in terms of the use of good technology, the use of a backbone of a digital connect is still far away. I think from our perspective, we really need to work towards evidence that we can present to the government for scale up. And we have started working in two areas, urban and rural, and I'll talk a little bit more about it, to really see how we could test out some of these innovations, which could then be taken up. And this is one of the Lighthouse initiatives from DCCC. That's a bit of a tongue twister, but we have really co-created most of this together. And we're really, really proud of that. So moving forward. Next slide, please. The DCCC and PATH, we actually share a common vision to really innovate, operation and operationalize mechanisms to advance the primary healthcare infrastructure and service delivery in India, and really looking at scaling digital solutions across the country. And of course, eventually we want the government to take these on. So we're kind of creating a model. We're trying to show how this can be scaled up. And then we would like the funding to actually come from the government of India, which has been allocated, and we're looking forward to that. The PHC strategy, we'll go to the next slide, please. So next slide, please. So we call it the comprehensive primary healthcare model, and we are in partnership with DCCC working in two parts of a state called Maharashtra in India, which is where Mumbai is. We are working in the slums of Mumbai on an urban primary healthcare model, and also a rural one in one district of India. Just to let some of you know, India has 700 districts. So a district in India is larger than many countries in many parts of the world. So it's a large geography. But the idea is that if we want to show interventions that can be scaled up, then that's absolutely going to be critical. And we're looking at a comprehensive approach. So it's across all diseases. It's really focused around the patient. We are looking at partnerships is going to be critical. There is no one organization who can actually deliver on this. So we will have to work with other not-for-profits, with government, with many of the private sector operators, and we're already talking to many of them, innovations, etc. DCCC has actually brought a lot of those to the table, which is fantastic, and that we're hoping to build up on that and demonstrate the scalability of this model. Because if we are able to do it in one district, we are hoping that the government will move it to all the 700, and we'll be able to test some of those innovations as we go forward. We've already started the work on this program. It's a new program, but we've been constructing it for the last probably about a year and a half now, along with DCCC teams. And now we're ready to roll out. We're funded. We're starting to roll it out already. We'll go to the next slide, please. In terms of partnerships and collaborations, as you'll see, we have already a collaboration with DCCC, which is, of course, very obvious. Philips. We're also looking at some of the innovations coming out of some of these organizations. The Citadel Foundation from the US has also bought into this program, and the government of Maharashtra is our closest ally as we move forward. So we've done we've done a landscape analysis of key partners, reached out to them. Government, as I said, and we are, of course, at the moment, we've started rolling it out. And as we go forward, we will be looking for further funding as well as for new partners. I think more than the funding, what I'm really very keen to do is, or what we are looking for is partners who can bring their knowledge from all across the world and really help us to think through, because there's nobody else who's actually done this before. This is really lighthouse. So I'm really hoping that we'll be able to get a lot of different partners who can help us think, who can help us actually structure and use these platforms to test out some of the innovations and look at how that can be scaled up. This could also actually, more importantly, this could act as a great lighthouse for the rest of the world, for other LMICs. If we're able to crack a district in India, like I said, it should work in many other countries of the world. We'll go to the next slide, please. So in terms of the next slide, please. Thanks, Liam. That's my final slide. So in terms of where we are headed, the way forward, at the moment, of course, we are in the exploratory phase. We've started, we've started the project. We've got the government permissions, etc., and designing, mapping, doing a baseline. All of that is happening. One of the big indicators for us is footfall. And if the footfall increases, that means we are providing better services. And that means that there is an element of trust and better care that's available. We would like to then demonstrate a lot of different innovations, both in digital devices, diagnostic, connected diagnostics, screening tools, and of course use artificial intelligence and whatever tools we can, which don't necessarily need a trained person at the primary health center. And then finally, we want to build the systems around the scale up and how this could be done, and also ensure that these are actually going to become part of the government's budgets going forward. That's all from me. I think the next slide is the closing slide. So thank you so much. And it's really been a pleasure to talk to all of you. And I look forward to your questions and talk to you more. Thank you.
Thanks
Back
so
to you.
much. Thank you so much, Neeraj. And really, really exciting what you're embarking on. And as you said, huge potential for scalability and replicability, very much as the Take Care Africa initiative shows as well. So if it's all right with the two of you, I've got a couple of questions to kick us off. And what I would say ahead of time is I think these are both projects I think the rest of us are all going to be really keen to see how they evolve over the next few months. And maybe we can get back together at the same time next year to see progress. And there's a lot in terms of what you've talked about in terms of your strategy, your methodology and content. But we're going to focus a little bit more around the issues around partnership and collaboration, if that's okay. So Sarana, I'm just going to start off with you. If you could sort of tell us a little bit about, you've obviously, you mapped out a whole range of partners that you clearly identified as being key to making this partnership, the Take Care Partnership Africa, successful. How have you evolved that? And how did you get the people to work together with you on this bold initiative?
Thanks, Claire. I'll start with saying that we really did some background and research when we started. We did some research on the digital penetration in Nigeria, Tanzania, and across Africa. Like I mentioned, we did some research on how people got their health information, both online and offline. Now, all this fed into the kind of partners that we needed to take this forward, to take the platform forward. It fed into the fact that because people trusted doctors, trusted their health workers, that we needed to bring in health workers as key partners for content development. It fed into the fact that people wanted expert global health information, and we brought in Rutgers to help with SRH content. Right. So it helped us to identify the kind of partners that we needed. And in talking to them, we also led with the numbers, right? The numbers help us to tell a story of one, the demand for online health information, and how currently the supply was inadequate, right? In Nigeria, in Tanzania, people want that actionable health information. But so far, we don't have a central place where they can go and get it, and to help them navigate, let me put it that way, the health system. Okay,
great.
Claire?
Yeah, thank you. Thanks so much. And Neeraj, obviously, the relationship with the government of India is absolutely critical, and you're feeding into part of the government of India's strategy. How did PATH navigate that relationship, and how did you build trust? Because obviously, working with the government is critical to developing something that will be sustainable and delivered at scale.
So I think, Claire, we already had a little bit of a head start because PATH works as a technical advisor to the government, both at the national level as well as the state level. In the state of Maharashtra, we've been running the TB program, which is a private-public partnership model for the last 7 years. We built it, we ran it, we scaled it up, and then the government took it on. So there was already an element of trust in that. PATH is also well known for its innovations and devices, diagnostics, vaccines. We do a lot of work in that space. So there again, we had a head start. I think what we did bring to the government actually, which really appealed, was the idea of this platform of partnerships, which is what the government was missing and also not able to really do very well. Convene private sector, convene other not-for-profits, bring in the academia, and try and build this platform where you can actually come in with some crazy ideas, try them out and see, what's working. We don't really have the answers. I know in the development sector, we always believe we have the answers, but I'm very happy to say we don't have the answers. We need to put them together. There's got to be an amalgamation of a lot of thoughts, and that's what's going to work. So that idea to the government was great. So they've said, okay, here's a platform, use it, show us what's working, tell us what's not working. Path also being a non-conflicted partner, because we're not trying to sell a product, we're not trying to make a profit. We're here for impact. So I think that also helps. But yeah, I think bringing in the private sector is really going to be helpful.
So you've answered my next question, which is whether you think the sort of a private sector actor would have been able to achieve that sort of initial relationship in the same way. And it sounds from what you've just said, possibly not, but now you're in a stage to bring them in. And I suppose for you, the benefit of the DCCC has been to be able to kind of really bring together sort of a multi-sector, sort of multi-stakeholder group to work with you on this.
Absolutely, and it's amazing because DCCC, what it's brought to the table is organizations who have some great products, some great ideas, etc. A lot of great minds, people you could brainstorm with and really come up with some path-breaking sort of ideas. So that's another thing that DCCC has done, and of course funding. I mean, we being a not-for-profit, funding is what keeps us going. But I would give more credit to that level of partnership that we brought in. So I would actually tell the audience that, please do join DCCC. Welcome to Maharashtra. As soon as we get over this new variant, we'd be happy to take you to the field, see what we're doing, jump in. This could change. Hopefully, this would have a high impact on universal health coverage and primary healthcare across the globe. We're hoping.
Great, thank you. And I think Niraj, you've got a question in the chat. So I don't know if you want to have a quick look at that. And I'm just going to go back to Sarano and just talk to you on the same topic around kind of the government, private sector, NGO collaboration, and how you see in the project that you're leading the role of both government and the private sector, what the opportunities are there.
Well, in most African countries, the government is still the largest provider of health services. And so I think there is what I would call a synergistic partnership already there because of that, right? The platform itself, Take Care Africa platform, we want to provide actionable health information. The government is already providing health services to most people. So therefore, that partnership is there. We are trying to make the health services that they provide more transparent. We're trying to provide information for people, for the populace that they serve, to be able to navigate their health services that they provide. Right now, currently, in terms of concrete actions, we're actually talking with the governments of both countries in terms of how we can get that information from them, get their data, put it online, and help people navigate. For the private sector, it's the same, almost the same thing or the same way. But here we're expanding our scope of partnerships. Just like I mentioned, we're talking about content partners. We're talking about financial partners. We're talking about investors also, which we're expanding for the private sector.
Great, thank you so much, Sarana. So Niraj, I have an audience question, which is how does the Lighthouse Project create an opportunity for the private sector, given that government procurements can be lengthy and unsure, which is certainly true. There is, something that kind of holds back private sector companies in terms of engaging with government, particularly in low and middle income countries. Well, I think globally, actually.
Sure. So the Lighthouse Project is not going to act as a sales agent for any private sector product, just to be very upfront. What it will do is it will have an operational trial, which will be non-conflicted. It will be, looking at impact. There will be an economic analysis of what it costs, and governments will have access to that information. Now, from our experience over the last decade, we found that as long as that information is there, and the government is able to see that how that product or the service helps, and how it can be scaled up, and what the cost is, and if they can afford it, sales does happen. But I think you should be looking at the Lighthouse project more as a platform for the solution that you may have. That's pretty much what this project would be able to do.
Great, thank you. So back to Nigeria and Tanzania. So Serrano, we have a question for you, which is, given the business model, how would you manage the risk of ads that may market health products and services that are not evidence-based, taking over the evidence-based health information provided by, given that you obviously want to have a very evidence-based information, how are you going to manage the sort of quality control of the products that are advertised, if that's one of your kind of ways of generating revenue?
Yeah, thanks, Claire. This was one of the things that we actually really discussed, while we're developing the platform, and that how can we critically review ads, so to speak, if we're going to go that direction in terms of attracting funding, right? And I think that's one of the most important things, in that setting up a review board, so to speak, or a review committee that looks at every ad and each ad. We've already decided on the type of organizations we want to partner with in terms of receiving ads from them. We've looked at the type of ads we can work with, right? And generally, I think it's really something that we're really going to sit down and discuss in terms of, do we actually, what kind of ads exactly do we want? We have our review committee in place. We have a review guide in terms of the ad quality and the ad direction. And I think we're going to stick with that as we're approaching, or as we're going into receiving ads and other types of health promotions.
Great, thanks very much. So unfortunately, I think we are kind of coming up to the end of our time. So if people do have further follow-up questions, please don't hesitate to kind of reach out to any of us on the panel, or most importantly, reach out to our colleagues at the DCCC, who will both be able to provide more information about these projects, but also around the DCCC as a whole. I think for us and for me, what I've kind of heard today is these are two really exciting initiatives that have at their bases both kind of detailed research and evidence based on kind of what is needed, what has worked, what hasn't. They've got really clear partnership strategies to bring in the key stakeholders, and fantastic opportunities for replicability and scale, all using digital technology to really help advance UHC. So I think these are really exciting initiatives, and looking forward to sort of hearing a little bit more about how they progress. I can see that Dr. Serrano has already got another couple of questions coming up. So I'll see if he's got the opportunity to respond to those, either to you before we kind of finish up, or directly. So we're very keen to sort of hear more from further collaborators, both on these specific projects, but also from those who want to sort of join the DCCC more generally. So I'm going to leave Dr. Serrano to kind of answer the couple of questions. And actually, I think, Neeraj, there may also be something for you as well in the chat. Other than that, I'm not sure if we if there's anything Serrano or Neeraj want to add in. If not, I will say thank you very much to both of my panelists. It was been fantastic meeting you and hearing about these wonderful initiatives. And we look forward to connecting again, because we're all part of the DCCC. So we'll get an opportunity to speak to each other again in our regular meetings. Thanks all very much for joining us.
Thank you all. Thanks. Bye-bye.
Thank you, Claire. Thanks, everyone.